Assalamu alaikum, my name is Jenan and today I'm going to be covering the nerves of the thigh region. So we'll have a general overview about the both plexi that we took in the lower limb, both the sacral plexus and the lumbar plexus. So we'll start off by the lumbar plexus. The lumbar plexus is comprised of the nerve roots L1, L2, L3 and L4. And it will form around 5 nerves. So the L1, it will continue and give us an ilioinguinal nerve. L1 and L2 give us genitofemoral nerve. Then the lateral cutaneous nerve of the thigh will be from L2 and L3. And then the nerve roots L2, L3, L4 will give both the femoral nerve supplying the anterior thigh or the anterior compartment of the thigh, and also gives the obturator nerve which will supply the medial compartment of the thigh. So let's look at each and every single nerve. The ilioinguinal nerve, again, nerve root is L1. Those first 3 nerves that we mentioned, ilioinguinal, genitofemoral, and lateral cutaneous nerve of the thigh, are all going to supply cutaneous innervation. So they're all going to supply the skin of a specific region. The ilioinguinal nerve will continue parallel to the inguinal ligament or the inguinal ligament and supply the skin in the inguinal region, hence the name. The genitofemoral nerve, having the nerve root of L1 and L2, will divide into 2 branches, as the name suggests, a genital branch and a femoral branch. The genital branch will go deep into the pelvis and supply genital organs. But the femoral branch will go under the inguinal or behind the inguinal ligament and supply the skin of the femoral triangle, which is the triangle in the superior inner part of the thigh. The last cutaneous nerve is the lateral cutaneous nerve of the thigh, with a nerve root of L2 and L3, and as the name suggests again, it is supplying the skin of the lateral part of the thigh. So ilioinguinal will supply the inguinal region, genitofemoral, the femoral branch is supplying the femoral triangle, and lateral cutaneous nerve will supply the lateral part of the thigh. The fourth nerve is the femoral nerve. The femoral nerve is going to supply the anterior compartment muscles, and the nerve root of it is L2, L3, L4. Before the nerve enters under the inguinal ligament, it will divide and give 2 main branches to supply 2 muscles, the pectineus muscle and the iliacus muscle. The iliacus muscle is actually, we refer to it as the iliopsoas muscle. But the psoas major is not going to be supplied by the femoral nerve because it will be supplied by the anterior rami of L1, L2, L3, as it's technically an abdominal muscle coming from the vertebra. So the femoral nerve will initially supply the pectineus and then the iliacus. Then it goes under the inguinal ligament, most laterally outside the femoral sheath. And above the lateral circumflex femoral artery, it will divide into 2 main branches. It will divide into an anterior branch and a posterior branch. The anterior branch will mainly supply the sartorius muscle, and then it will divide and give 2 main cutaneous supply. It will supply the intermediate thigh and the medial thigh. So intermediate cutaneous nerve of the thigh and the medial cutaneous nerve of the thigh. And then it stops at the thigh region. Unlike the posterior division, which will continue to supply the quadriceps muscles, اللي هم vastus medialis, vastus lateralis, vastus lateralis, intermedialis, and medialis, and then finally rectus femoris. And it will also supply both the joints, the hip and the knee joint. But the nerve doesn't stop at the thigh region. It continues as a saphenous nerve, which is a cutaneous nerve supplying the medial leg up until the medial foot. So again, the femoral nerve, L2, L3, L4, initially divides to supply iliacus and pectineus, and then it will divide after it passes the inguinal ligament most laterally outside the sheath. It will divide above the lateral circumflex femoral artery into an anterior and a posterior. Anterior will supply sartorius and give cutaneous for the intermediate and medial thigh. The posterior division will supply the quadriceps and both the hip and the knee joint, and continue as the saphenous nerve to give cutaneous supply for the medial compartment of the leg, or the medial part of the leg and the foot. The last nerve of the lumbar plexus is the obturator nerve, supplying the medial compartment muscles. The obturator nerve, similar to the femoral nerve, also has the nerve root L2, L3, and L4. It is a mixed nerve, so it will give both a cutaneous and a muscular supply or a motor supply. We have this big opening, we call it the obturator foramen. It will be covered by a membrane except for a small opening, and we call that opening an obturator canal. This is where the obturator nerve will enter, and then it will split into an anterior and a posterior division. The anterior division, both divisions are going to give muscular branches, but the anterior is the part that will give the cutaneous supply of the medial thigh, and the posterior will also give articular. Continue a bit more downwards, we will find the sacral plexus. The sacral plexus is comprised of L4, L5, S1, S2, S3, and S4, but we will mainly cover around 4 nerves. From L4, L5, S1, we have superior gluteal nerve. L5, S1, S2, we have inferior gluteal nerve. S1, S2, S3, we have posterior femoral cutaneous nerve. And then from L4, L5, S1, S2, S3, we have the sciatic nerve. The first two nerves, the superior and inferior gluteal nerves, are going to supply muscles only, and the posterior femoral cutaneous nerve will only supply cutaneous supply. It will only supply skin. And then the sciatic nerve will have mixed, so it will have both motor and sensory innervation. Superior gluteal nerve is coming or having the nerve roots of L4, L5, S1. And it will supply gluteus minimus, gluteus medius, and tensor fascia lata. So muscles of the gluteal region. As we said, doesn't have any sensory innervation. But where does it exactly enter? In the pelvic or in the hip bone, we have an ischial spine, dividing it into a greater sciatic foramen and a lesser sciatic foramen. In the greater sciatic foramen, we have a muscle spanning that region called the piriformis muscle. And this will divide it into a superior part of the greater sciatic foramen and an inferior part of the greater sciatic foramen. The superior gluteal nerve is entering in the compartment above the piriformis muscle, unlike the inferior gluteal nerve and the posterior femoral cutaneous nerve, which will enter under the piriformis muscle. The inferior gluteal nerve is having the nerve root L5, S1, S2, and as mentioned, doesn't have any sensory innervation, only goes to supply gluteus maximus. Posterior femoral cutaneous nerve, nerve roots S1, S2, S3, also entering in the greater sciatic foramen under the piriformis muscle, and unlike the first two nerves, does not have any motor function or muscular sensation, muscular innervation. It would only supply the skin of the posterior part of the thigh and the upper leg. So again, as the name suggests, it's a posterior femoral cutaneous nerve. So it's supplying the posterior part of the thigh and the upper part of the leg. So again, superior and inferior gluteal nerves are supplying muscles. Superior is supplying gluteus minimus, medius, and tensor fascia lata. Inferior is supplying the gluteus maximus. Both of them don't have any sensory innervation. Superior gluteal nerve is entering above the piriformis muscle in the greater sciatic foramen, and the inferior gluteal nerve and the posterior femoral cutaneous nerve are entering under the piriformis muscle in the greater sciatic foramen. Posterior femoral cutaneous nerve is supplying the posterior part of the thigh and the upper leg. Now we move on to the sciatic nerve. The sciatic nerve is the biggest nerve in the body. The nerve roots of it are L4, L5, S1, S2, and S3. And as previously mentioned, it's a mixed nerve, so it will have both a motor innervation and a sensory innervation. So initially, like inferior gluteal nerve and the posterior femoral cutaneous nerve, it will enter the pelvis region or the gluteal region via the greater sciatic foramen under the piriformis muscle. But unlike the first two nerves we mentioned, the sciatic nerve does not divide or does not branch in the gluteal region. It continues downwards to enter the posterior thigh, right in the middle of the ischial tuberosity and the greater trochanter. And then it divides and gives branches. It will give muscular branches for the muscles of the posterior compartment of the thigh, اللي هم semitendinosus, semimembranosus, biceps femoris, and the ischial part of the adductor magnus. And it will also give articular branches for the joint it will pass, which is the hip joint. And it terminates at the popliteal fossa into two main branches. Popliteal fossa is the fossa in the back or the posterior part of the knee. So again, the sciatic nerve is coming from L4, L5, S1, S2, S3. Enters the gluteal or the pelvis region via the greater sciatic foramen under the piriformis muscle. Doesn't branch and divide in the gluteal region, but continues in the thigh and supplies the muscles of the posterior compartment, the hip joint, and terminates at the popliteal fossa. At the popliteal fossa, it's terminating into two main branches, the tibial nerve and the common peroneal nerve. Tibial nerve is also known as the medial popliteal nerve, and the common peroneal nerve is also known as the lateral popliteal nerve. The tibial nerve is the larger one of the two. It's a larger branch, and it continues downward and posteriorly, straight and posteriorly, and terminates at the lower border of the popliteus muscle as the posterior tibial nerve. While it's going downward, it will give certain branches. It will give the muscular branches to supply certain muscles in the leg, اللي هم gastrocnemius, soleus, plantaris, and the popliteus muscle. It will also give genicular branches, which are the superior medial genicular nerve and the inferior medial genicular nerve and the middle genicular nerve, which is entering inside the joint. And also gives cutaneous sensation, which is the sural nerve. So the sural nerve is going to descend between the two heads of the gastrocnemius muscle, and it will pierce the fascia and it will appear superiorly. And it will then be joined by another nerve, which is called sural communicating branch. This is coming from the common peroneal nerve, which is the other branch of the sciatic nerve. So the sural nerve along the sural communicating branch continue downward, accompanied by a vein, by the small saphenous vein, and they continue downwards and laterally to go below and behind the lateral malleolus until it supplies as the name suggests, or as we mentioned, it's a cutaneous nerve. So it's supplying the lower half of the back of the leg, so the lower part of the leg, because the posterior femoral nerve is supplying the upper part of the upper posterior part of the leg. So the lower half of the back of the leg will be the sural nerve. It will also supply the lateral side of the dorsum of the foot and the lateral side of the little toe. So again, the sciatic nerve initially starts off entering the greater sciatic foramen under the piriformis muscle. Doesn't give any it doesn't divide into the gluteal region, but it continues in the posterior thigh, gives muscular branches, articular for the hip, and divides in the popliteal fossa to give tibial and common peroneal. Tibial will continue straight and posteriorly and will terminate at the lower border of the popliteus muscle to become the posterior tibial nerve. Before it terminates, it gives muscular branches to gastrocnemius, soleus, plantaris, popliteus, genicular, اللي هم superior and inferior, medial genicular nerve, middle genicular nerve, and it also gives a cutaneous supply, which is the sural nerve. Sural nerve will continue between the heads of the gastrocnemius muscle, piercing the fascia, pierce superiorly, will get accompanied by or joined by the sural communicating branch from the common peroneal, and continues laterally and below and behind and below the lateral malleolus to supply the lower half of the back of the leg, the lateral side of the dorsum of the foot, and the lateral side of the little toe. The other branch is the common peroneal nerve. The common peroneal nerve is the smaller of the two branches. And what this branch does is it goes and turns around. So it will go and laterally go along the tendon of the biceps femoris. The biceps femoris muscle is it's going to get inserted inside the fibular head or on the fibular head and the lateral condyle of the tibia. So this common peroneal nerve will continue downwards, and then it will go laterally along the biceps femoris. And then it will enter inside a muscle. It enters inside peroneus longus and terminates and divides into two main branches. It is going to divide into the anterior tibial nerve and the musculocutaneous nerve. Anterior tibial nerve is also referred to as the deep peroneal nerve, and musculocutaneous is referred to as the superficial peroneal nerve. Before it terminates, it will supply and give certain branches. Unlike the tibial nerve, the common peroneal does not have any muscular branches. It has genicular branches, giving the lateral aspect, so the superior and inferior lateral genicular nerve, because the tibial was giving medial. And it also gives, the common peroneal also gives a recurrent genicular nerve, so a nerve that will go back up. And it gives cutaneous branch. It gives the sural communicating nerve, which will continue and join the sural nerve, supplying the lower half of the back of the leg and the lateral dorsum of the foot and the lateral part of the little toe. And also gives lateral cutaneous nerve of the calf, so supplying the lateral part of the, so cutaneous innervation for the lateral calf. So the sciatic nerve, coming from L4, L5, S1, S2, S3, continues and enters the gluteal or the pelvis region via the greater sciatic foramen above the piriformis muscle. Doesn't branch in the gluteal region. Enters between the ischial tuberosity and the greater trochanter into the back of the thigh. When it enters the back of the thigh, it will give muscular branches for the muscles in the posterior region. It will also supply the hip joint and then terminates at the popliteal fossa into two main nerves, the tibial nerve and the common peroneal nerve. Tibial nerve is also known as the medial popliteal nerve, and the common peroneal nerve is also known as the lateral popliteal nerve. Tibial is the larger of the two, continues downwards and terminates the popliteus muscle. When it terminates, it will give us the posterior tibial nerve. Gives muscular branches, genicular branches, and cutaneous branch for the sural nerve. Common peroneal nerve, which is the smaller of the two, it will run downwards and then go along the biceps femoris tendon laterally. And then when it goes laterally, it will pierce the peroneus longus muscle and divide to give anterior tibial or the deep peroneal nerve and the muscular nerve, which is the superficial peroneal nerve. And then before it branches or terminates, it will give genicular branches and cutaneous branches. The genicular are the superior and inferior genicular nerve and the recurrent genicular nerve. And then it will also give the sural communicating nerve, which is the nerve that will accompany the sural nerve, tibial nerve. And then it will also give lateral cutaneous nerve of the calf. And thank you.